My name is Daniela Jezova. I am professor of pharmacology. I come from Slovakia, Institute of Experimental Endocrinology of the Slovak Academy of Sciences in Bratislava. I am happy to present at this Congress data on anxiety and cardiovascular responses to demanding stress situations. There is a flower which is called bleeding heart. The flower resembles the conventional heart shape with a droplet beneath. And actually this flower symbolizes the main message of my talk. If a heart is bleeding, there is certainly pain, fear, and anxiety. And these feelings can in turn influence the cardiovascular responses. Our main hypothesis was that anxiety as a personality trait would modify cardiovascular responses during stress. We investigated a group of young male volunteers with trait anxiety at the lower and at the upper limit of normal distribution of anxiety. By other words, it means that those with normal anxiety in the middle were excluded. We exposed them to a psychosocial stress in the form of public speech in front of unknown audience. They responded well to this stress situation, and we confirmed our hypothesis by higher heart rate elevation in anxious subjects compared to non-anxious. However, in contrast to all expectations and general view, the release of stress hormones was lower, not higher in anxious subjects. This was true also for the main cardiovascular hormones released during stress, catecholamines, epinephrine or adrenaline, or norepinephrine, noradrenaline. These were lower. Then we, as the next step, turn attention to the disease states which are accompanied by increased anxiety. We investigated a small group of patients with anxiety disorder called panic disorder. And in this group, we confirmed the data obtained in healthy subjects with high anxiety, namely reduced stress response by several stress hormones, but not by catecholamines. Catecholamine responses in this group of patients were normal, with the exception of higher basal levels of norepinephrine. Well, all this was done in a male subject, and it was highly motivating, so we designed and succeeded to get financial support for an ongoing project which is being performed in close collaboration with the Department of Psychology of the Comenius University in Bratislava. This project is on patients with different types of allergy, the condition known to be accompanied by high trait anxiety. And the data showed not only a reduced response during the psychosocial stress, but also gender differences between the subjects. We used as a parameter to reflect sympathetic activation the activity of an enzyme present in saliva. And the response of the activity of this enzyme was lower in atopic patients, so patients with allergy. But when we stratified them according not only to gender, but also to the phase of the menstrual cycle, we show that this is of real importance. So altogether, our data do not indicate a simple hyper or hypo responsiveness, but rather an impairment of the coordination of the stress response by high trait anxiety.